We will discuss cervical vertebra and also hyoid bone now. Okay.
Mm-hmm. Ma'am, the thing went away.
Yeah. See here, beta. Basically, we have 7 cervical vertebrae. Okay. So among them, usually we have typical and atypical. The meaning of typical is if they have same features, then we usually call it as typical. So third to sixth cervical vertebra are physically similar. Hence they are called as typical cervical vertebrae. Whereas C1, C2 and C7 have specific features and they are called as atypical. Before I discuss anything, I'll show you this. When it's going on. I think the window got closed, right?
Yes, ma'am. Yes.
We'll go in this way only because it's no, what is happening? So, are you finding the like cervical vertebra picture on the screen?
Yes.
Huh. So I said like T3 to T6 are typical cervical vertebra. Okay. So now let us
Mm-hmm.
see what are the features we have. Like see anteriorly it has body, posteriorly it has spine, and typical cervical
Mm-hmm.
vertebra the spine is bifid. Then this whole of this like thing what we have is actually anteriorly we call it as arch, posteriorly we call it as lamina. So this area is arch and this area is lamina, and at the junction of arch and lamina you are finding superior articular facet. So this superior articular facet will be articulating with the inferior articular facet of the vertebra above. Similarly, on the inferior aspect of this vertebra, we also have inferior articular facet. So the inferior articular facet will be articulating with the superior articular facet of the vertebra below. So that's how we will see the formation of intervertebral joints. Now immediately behind the body, as I said, this is the arch, right? So here you have a foramen in the transverse process of the cervical vertebra. That is this characteristic feature of the cervical vertebra. So in the transverse process, you have a foramen called as foramen transversarium. Okay,
Yeah.
through which vertebral artery passes. In fact,
The second part.
yeah. Now you see it has anterior tubercle, it also has posterior tubercle. So this arch in front you call it as like anterior root. Behind this area is called as posterior root. So this is anterior root, this is posterior root. Front is anterior tubercle, behind is the posterior tubercle. In between anterior and posterior tubercle, the area is called as costotransverse bar. Connecting these arch and the lamina, the area is actually called as pedicel. Okay, pedicel. And
Mm-hmm.
whatever big hole you are finding foramen, you call it as vertebral canal through which spinal cord will be running. Okay, so these are the
Mm-hmm.
characteristic features of the typical cervical vertebra. Okay, then
Yeah.
The cervical vertebra are identified by the presence of this foramina transverse area. Just now what you saw in the transverse process. So as I said, we have 7, out of which 3 to 6 are typical, while C1, C2 and C7 are atypical. Body is small as you have seen, and it is broader from side to side. Superior surface is concave and it is projecting upwards. Then vertebral foramen is larger when you compare with the body, because the medulla oblongata, that is the brainstem, is now directly continuing, isn't it? Now vertebral
Mm-hmm.
arch I have shown you anteriorly, the pedicels are directed back. See, whatever I have shown you is texted better, and you are also in a hurry to join, so you just the group discussion, right? So shall I proceed?
Yeah.
Pedicels are directed backwards. Laminae, I said, are behind. No, they are relatively long and narrow. Mm. Transverse process, I said we have foramina transverse area. So anterior and posterior, everything I have shown you in the form of picture better. There is nothing like which we didn't discuss. Superior
Right.
facet, inferior articular facet, everything we have discussed.
Yeah.
Now, see here. Now we are moving to the other vertebra, that is the atlas. Before I move to atlas, you see here, this is the first cervical vertebra which is seen as atlas, below which you have second cervical vertebra, that is axis, C1, C2. Then these are C4, C3, C4, C5, C6, which are typical ones. C7 will have one special feature, like that is the one more atypical cervical vertebra. So in between, see, this will be inferior articular facet of C1, this will be superior articular facet of C2, intervertebral joint. Similarly, you can see each vertebra. Like suppose this is C4, this is the superior articular facet, this is inferior articular facet. In between, like if you see, between the superior articular facet and inferior articular facet, whatever joint is formed, you are finding there is one hole which is called as intervertebral foramen. This intervertebral foramen will be giving passage to spinal nerves, like we have C1, C2, C3, C4, C5, C6, C7, C8 spinal nerves. Okay. Now,
Mm-hmm.
this is the anterior aspect. Now, in case of first cervical vertebra, in the anterior aspect, you have a tubercle which is called as anterior tubercle. The attachments of the structures are, we have anterior longitudinal ligament in front. Okay.
Mm-hmm.
Like the anterior tubercle of the first cervical vertebra, it gives attachment to the anterior longitudinal ligament. Upper border of the anterior arch, like between the atlas and occipital bone, I said we have atlanto-occipital joint, if you remember, when we were doing norma basalis, isn't it?
Yeah.
So connecting them, we have atlanto-occipital membrane. Similarly, we also have posterior tubercle, like we have anterior tubercle. Posterior tubercle is behind, and it gives attachment to ligamentum nuchae in the midline. Ligamentum nuchae. Okay. Now, if you just observe, this is the atlas vertebra. So, atlas vertebra has, like, body is not there only. You are finding simply anterior tubercle and posterior tubercle. Basically, the body of the first cervical vertebra is actually considered as the dense part of the second cervical vertebra, which is generally considered like morphologically and during development. The dense is attached to the second cervical vertebra, which is now considered as the body of first cervical vertebra. That's the reason we do not have body with C1 atlas, only anterior tubercle, posterior tubercle. So this is arch, already I told you anterior arch, this is posterior arch. These are transverse processes where we have transverse foramen for the passage of the vertebral artery. So this is the superior aspect. On the superior aspect, you are finding the superior articular facet, which is correspondingly like concave, in order to articulate the convex occipital condyles of the occipital bone of the skull to form atlanto-occipital joint. This is vertebral foramen. Okay. So in this vertebral foramen, you are finding there is one transverse ligament which is dividing the vertebral.
Cruciate ligament, right?
Yeah. So this transverse ligament is
Mm-hmm.
actually dividing in, no, the whole of the vertebral foramen into like anterior and posterior halves. In the anterior half, you are finding the projection of dens, also called as odontoid process. So odontoid process will be having bursa anteriorly and posteriorly so as to elicit free movement of the atlanto-occipital joint. The other attachments we see in the anterior arch are we have rectus capitis anterior, rectus capitis lateralis, levator scapulae and superior oblique. Behind we have rectus capitis posterior minor. Okay, so these are the muscle attachments. Now, this is also one of the typical cervical vertebra. Already we have discussed the features of it, right? So, like anterior arch, posterior arch, isn't it? And then anterior tubercle, posterior tubercle. In between, I said we have costo-transverse bar. So, whole of this is actually called as costal element. Behind thing is transverse element. You can see inside the cervical vertebra, spinal cord is passing through intervertebral foraminae, cervical nerves are coming out. Okay.
Mm.
So superior facet we have, inferior facet we have, intervertebral joints we have. Okay, at the transverse processes and at the body also, in between body also we have intervertebral joints. So this is the lateral view where you can see through vertebral foramen, spinal cord is passing through intervertebral foramina, the spinal nerves are coming out. So atlas, this is again superior view only. This Vishram Singh's picture, this is anterior tubercle, posterior tubercle, superior articular facet, transverse foramen. Everything we have discussed in the previous pictures along with the attachments. So this is also atlas, Netter's atlas picture. Atlas,
Mm.
plus cervical vertebra. This is superior view, this is inferior view. Inferior view is also presenting a like concave facet in order to articulate with the superior articular facet of the axis vertebra to form atlantoaxial joint. Okay.
Yeah.
So in the atlas, we don't have body, we don't have spine also. Like in typical cervical vertebra, you have seen bifid spine. No such thing is missing here. Okay, it has long transverse process, isn't it? Then it
Mm-hmm.
has superior articular facet which is concave, elongated, kidney shaped. It has inferior articular facet which is less circular. Now coming to the second C2, also called as axis. This is actually dense, which is considered as a body of cervical vertebra which got separated and got attached to axis. Okay, so it will show certain impressions for the attachments of ligaments like at the apex we have apical ligament, just below we have impressions for alar ligament. Okay, now above we have superior articular facet. So these are the transverse processes, transverse foramen. Behind we have spine which is bifid and this is lamina. Okay, second cervical vertebra is axis. So we see the presence of denser odontoid process which is strong tooth-like projection upwards. So superior surface is fused with dens. The dens is articulating anteriorly with the oval facet on the posterior surface of anterior arch of atlas, what we have seen. Posteriorly, you said cruciate ligament, right? I said it is transverse ligament. So posteriorly, odontoid process will be getting the attachment of this transverse ligament. So pedicels are concealed superiorly because of the presence of superior articular processes. Inferior surface is also presenting like deep and wide inferior vertebral notch. Lamina are thick and strong. So like superiorly it articulates with C1, inferiorly it articulates with C3. Okay. Spine is large, thick and very strong. Dense is providing attachment. That ligament at apical alar ligament we have seen front we have anterior longitudinal ligament that also I said. Posteriorly we have posterior longitudinal ligament. Okay. Spine gives attachment to ligamentum nuchae. The spine is strong and bifid. This is vertebral foramen. Foramina transverse area. Facet for atlas. So this is dense odontoid process. C2. So odontoid process, this transverse processes are small. It doesn't have any anterior tubercle C21. So anterior margin of inferior surface is projecting downwards. Like almost all points are discussed. Now the another typical like atypical vertebra we have is seventh cervical vertebra. Just look, body is quite big. Transverse process is showing foramina transverse area. Superior articular facet to articulate with C6. Spine is not bifid and it is quite big and straight. You can palpate it for yourself. okay, which is called as vertebra prominence. Vertebra prominence we see with seventh cervical vertebra.
This is where the ligamentum nuchae ends, right?
It gives attachment to ligamentum nuchae. So vertebra prominence, its spine is thick, long and nearly horizontal. It's not bifid. Okay, the ends, it is ending in a tubercle. Foramen transversarium is very small. Sometimes it may be double also, or sometimes it may be absent also. Okay, it doesn't transmit vertebral artery. Okay, tip of the spine, as you said, ligamentum nuchae. Not only that, you will see some muscles are also originating like trapezius, rhomboids minor, serratus, posterior superior, splenius capitis, semispinalis thoracis, splenius cervicis, interspinals, and multifidus. So many names you will not be able to remember, and don't try also, they won't ask, don't worry. Transverse process usually transfers only an accessory vertebral vein. Okay, so anterior route of transverse process may sometimes be separate. Mm,
Right.
yeah. So the joint.
Simpson's fascia is attached to
Yes, beta.
the C7, right?
Which one?
Simpson's fascia.
Ha. Yes. Yes. No, the joints in the lateral part of adjacent bodies of cervical vertebra, they are called as Lushka's joints. This is another term. Okay, one more term. So sometimes osteophytes may be seen at this point. Cervical spondylosis. Some people complain of neck pain, no? So in those people, you will see osteophytes may increase. Okay. In between like between vertebrae, we usually have intervertebral discs. So sometimes the disc may prolapse. Sometimes there may be fracture also due to the pedicels of the axis vertebra. So this is intervertebral disc which may herniate like this. The
Yeah.
joint between this is Lushka's joint. So fracture of odontoid process we generally see during hanging. Okay. So one more bone what we have is hyoid bone which is U-shaped. We will see the picture. So it has body. The body has upper border, lower border, anterior surface, posterior surface. It has a smaller projection, lesser carno, bigger projection, greater carno. And if you just look at this picture, you will know the muscle attachments. Okay. No, the muscle attachments, when you see from inside view, we have like genioglossus, geniohyoid, mylohyoid, sternohyoid. These are all insertions. Okay.
Ma'am, we didn't do hyoid bone.
Acha, you didn't do. Okay, you need not worry then. So this is the anterior attachments. Okay, then
Is it important? Yes,
yes.
ma'am.
Okay. So anterior view of the skull is nothing but norma frontalis. So what are the various bones we see? We see frontal bone, like we also see a part of parietal bone, two bony orbits. So inside the orbit we will see different bones will be contributing. Okay, so we have nose formed with nasal bone, so many other I'll tell you. This is maxilla, zygomatic bone, and mandible. Okay, so six regions we see here, like frontal region, orbital region, nasal region, zygomatic region, maxillary region, and mandibular region. Okay, so forehead is basically formed by the frontal bone. So there you have this area is Nesian, and this
Mm.
place which is the
Glabella.
glabella. Okay, and these are this raised arches.
Superciliary arches where the corrugated supercilii will arise from.
Yeah, and we also have frontal eminences. The most prominent area of frontal bone is the frontal eminence. Okay, so in norma frontalis, so these are the various bones which you already know. So this is individual frontal bone. I said like this are two individual bones in fetal life. Like there is a suture. What is that suture? They will ask you tomorrow.
Interfront frontal
Metopic,
suture?
metopic suture.
Oh, right, metopic. Right, of
Metopic
course. I
suture.
keep
Fetal it
forgetting.
is present. Okay, this
If at
area
all.
is
Okay.
glabella. So these are the roofs of orbit which are contributed by orbital plate of frontal bone. Okay, this area is towards nose. That means the frontal process of the nasal bone. Like that it will be named supraorbital foramen. at superciliary arches. So this is all frontal bone only, which is seen from front anterior view squamous part. So these are supraorbital margins and supraorbital foramen you are finding. Okay. So inside, yesterday I have shown you the calvaria. So I have told you like correspondingly inside we have frontal crest, isn't it?
Yeah.
Mm. If you remember, in the anterior cranial fossa, I told you we have frontal orbital plate of frontal bone. In between, we have cribriform plate of ethmoid, isn't it?
Yeah.
Uh, so these are all ethmoidal air sinuses. Crista gale you will see in the center. So metopic suture you can see here. Sometimes it may be found. Superciliary arches. Pterion. Superior orbital fissure inside the orbit. Inferior orbital fissure is also seen. Zygomatic inside the nasal bone. See, this is the nasal septum. We have superior nasal concha and middle nasal concha. Inferior nasal concha is a separate bone not coming from perpendicular plate of ethmoid. Okay, so this is maxilla area. So canine eminence, lower jaw, mandible, mental foramen. So all individual skull bones you can see here. Okay.
Yes.
Mm. So orbits, first we will see orbits, then you will easily understand. Now see, these are the supraorbital margins, and orbit will have certain boundaries like it has roof, it has floor, it has medial wall, it has lateral wall. The most posterior area, it is like a pyramid, no, like it will have an apex where we have the opening of optic canal. The two fissures, what we have superiorly, superior orbital fissure, and inferior fissure is the inferior orbital fissure. So like that we have supraorbital margin, which is this. We have supraorbital notch also. This becomes the lateral margin. This is infraorbital margin, and towards the midline is the medial margin. Okay. So no, this is supraorbital margin where we have the supraorbital notch. Okay. So this is the infraorbital margin. We have below this we have infraorbital foramen. So towards this is the medial border then, because nasal bone is this side. So that means that is the left orbit we are seeing here. Okay. Then mm, optic canal, you can see superior orbital fissure. Now this is the lesser wing of sphenoid bone, this is the greater wing. Between lesser and greater wing we have the superior orbital fissure. Now here inferior orbital fissure is present between the greater wing of the sphenoid bone and the maxillary bone, like orbital plate of the maxillary bone, and also a part of zygomatic bone. Okay. Different colors have been used so for our better understanding. Medially, you also see lacrimal bone, ethmoid bone, and a part of palatine bone. Okay. So here, like different colors have been used. Now, looking at colors only, you will be able to tell. First of all, you have to rule out which is wherever you find lacrimal, that side will be medial. Remember, so this is nasal side, nose. Okay, and this side would be lateral. So that means now you are talking about the right orbit now, right side. Roof is formed by orbital plate of frontal bone, supraorbital notch. Okay, and we have a fossa also laterally for the lacrimal gland. Okay, so this is the lateral wall. Lateral wall is formed chiefly by the zygomatic bone. Okay, so actually this process what you have is zygomatic process of frontal bone. This projection will be Frontal process of zygomatic bone. Two opposite terms are used. Then this is medial wall. Similarly, it will be formed by, no, this is maxillary bone. So maxillary process of frontal bone and frontal process of the maxillary bone. Okay. Floor is formed by zygomatic bone, maxillary bone. Okay. Apart from that, you are also finding the other bones like ethmoid bone. Okay. So as you go deeper on the lateral wall, we also find greater wing, and towards the roof we also find the lesser wing. We know like between the lesser and greater wing we have superior orbital fissure. So in within the lesser wing you will have a passage for optic nerve and ophthalmic artery, that is nothing but the passage is optic canal. Now between the greater wing of sphenoid bone and maxilla you have one more opening, that is inferior orbital fissure. Okay. So different, here the walls have been named. So roof of the orbit is formed by lesser wing of the sphenoid bone, then orbital plate of the frontal bone. Okay. Now this is the medial wall which is formed in pink color. We have the sphenoid bone. Okay, we have orbital plate of ethmoid bone in orange, frontal process of maxilla and lacrimal bone. This is completely floor which is formed by orbital process of palatine bone, this cream colored bone. Then orbital surface of maxillary bone, then zygomatic bone. Okay, the lateral wall, zygomatic process of the frontal bone, yellow in color. Then greater wing of sphenoid, pink color. Orbital surface of zygomatic, this blue color. Okay. All these are the boundaries of the orbit. Okay. Then malar prominence is this cheek prominence. So which is chiefly formed by zygomatic bone, which has like three surfaces and two processes. Lateral surface will present one foramen, that is the zygomaticofacial foramen. Here, zygomaticofacial foramen for the passage of the same name nerve, zygomaticofacial nerve. So zygomatic bone will have this orbital surface which you are seeing in this sky blue color. Will have temporal surface, frontal temporal process. It gives zygomatic arch also. So this area towards orbit is the orbital process. Towards maxilla is maxillary process. Towards frontal bone is frontal process. Towards temporal bone is temporal process. Temporal process only will continue as zygomatic arch. Okay, frontal process, temporal process. This is zygomaticofacial foramen. This is the zygomatic arch which we have seen in the norma lateralis.
Mhm.
This is the anterior nasal spine. And here we also find one aperture, that is the anterior nasal aperture. That means this whole of this big pyriform opening completely we name it as anterior nasal aperture. Okay. Then in the
Ma'am, in the
center,
zygomatic frontal,
which one?
zygomatic facial foramen, what passes
Zygomaticofacial
through it?
foramen is purely in zygomatic bone. You can see
Yeah, yeah. What is that? What passes through it?
same zygomaticofacial vessels and nerves. Not
So the
much particular.
zygomatic branch of the facial nerve.
Hmm. Not much particular, that won't be asked also, don't worry. Okay. Anterior nasal spine, nasal septum. In the lateral wall, you are finding these projections, which are nothing but the concave. Below concave, whatever areas are there, you call them as metasis. Anyhow, we will study the nasal septum again when we do the nose chapter. For now, you just try to remember the bones which are forming nasal septum are ethmoid bone, nasal bone, and vomer bone, palatine bone. We also have this hard palate formed by maxilla. The cartilages also we have like septal cartilage, greater alar cartilage. So within this nose, the soft tissue will show like surrounding this concave, like superior, superior and middle concha, and also we have inferior concha. Below this, we have superior
Okay.
meatus, middle meatus, and inferior meatus. Anyhow, that will be dealt when we do nose chapter. So this is cribriform plate of ethmoid bone. This is perpendicular plate of ethmoid bone. From perpendicular plate, you will see two projections. Those are nothing but the superior nasal concha, as you can see here. Middle nasal concha at this one. Inferior nasal concha is not coming from here because it's a separate bone. This is perpendicular plate. Cribriform plate, yesterday I told you, in anterior cranial fossa. Superior nasal concha, middle nasal concha, you can see. It's all cribriform plate. So in this view, actually, you are finding so many ethmoidal air sinuses. In the sphenoid bone, I said we have sphenoid air sinus. And in frontal bone, I said we have frontal air sinus. In maxillary bone, we have maxillary air sinus. And in the ethmoid bone, so many empty spaces are there, which are called as air cells. So these are anterior, middle, and posterior ethmoidal air sinuses. Okay. So this is the upper jaw, also called as maxilla. These are the alveolar processes. Again, it will have areas like, see, it has maxillary air sinus, I told you. Nasal surface, like it is forming the base of the maxillary hiatus, maxillary air sinus, nothing but. It has orbital surface. This is the orbital surface of maxilla, this one, in cream color. Then it has anterior surface, infraorbital foramen through which infraorbital vessels and nerves will be coming. This area will be canine fossa, where we have canine teeth. Just above you have a fossa, that is the canine fossa, incisive fossa, like that.
Mm.
Canine eminence also. These are incisors, hence incisive fossa. These are canines, hence canine fossa. A little elevated area, you call it as canine eminence. Okay. So, and posterior surface is forming the anterior wall of infratemporal and also pterygopalatine fossae. Okay. So it will also have four processes. Zygomatic, I'll show and tell you. So this area towards the zygomatic bone is the zygomatic process of maxilla. Then frontal process, which is going into the orbit, frontal process. Okay. Then palatine process is going down, forming the hard palate. Alveolar process is forming the, this is the alveolar process, which is giving articulation to the teeth. Okay. This is all about maxilla, where we have this maxillary air sinus, frontal area. Palatine process, I said it is taking part in the formation of hard palate. Alveolar process for the teeth. This we have already studied when we were doing norma basalis. So lower jaw is mandible. So it has condylar process, coronoid process. This is mandibular notch. This area is ramus. This is body. Junction of ramus and body is called as angle. And in the ramus, you will have a hole which is called as mental foramen. Okay. Inside there is a foramen which is called as,
Ma'am, we didn't do mandible either.
they didn't teach you yet.
No.
Okay then.